Good morning, distinguished ladies and gentlemen. You are welcome to our new concept, a project called Online Training Outreach, ONTRO, which is a program designed to bridge the gap between the PAC knowledge and the current realities in practice. This is a demo lecture presentation, and the title of the presentation is Primary Healthcare Strategy, Understanding the Concept, Core Values, and the Conceptual Framework. It is produced by Integrated Healthcare Strategies and Analytics Limited, an Abuja-based consulting firm. I'm the principal instructor, leading other faculty members drawn from relevant institutions and academia, and my name is MJ Abdullahi. I am a medical officer and public health physician with considerable background and expertise in primary healthcare system in Nigeria, and I have qualifications in medicine and public health. I have wide experience and exposure in primary healthcare spanning over 3 decades. At various times, I was a key player in some flagship PHC programs in Nigeria, including the World Health System, the Midwife Service Scheme, the Nigerian State Health Investment Project, and the PHC governance reform, often referred to as primary healthcare under one roof. I have participated in many national and international conferences, including several national councils on health, World Health Assembly, and WHO Afro-Regional Committee meetings, etc. The PAC dilemma in Nigeria. There is dilemma in PAC implementation in Nigeria. We have promoted, we have seen, and we have felt the practice of PAC for over 30 years in Nigeria. Recall PAC program was launched in 1986, yet we are still struggling for good results. The dilemma is that we know what a good, really pretty good primary healthcare should be. The challenge is that we don't do what we should to get good results. Doing the right thing. There are many reasons why we don't do what we ought to do to get good results. Not getting good results is not necessarily a matter of limited resources. My opinion is that many a times we don't know what to do because of limitation in know-how and skills. Creating ONTRO program is a token contribution towards building necessary understanding of what we can do. What are the learning objectives of this lecture? Understanding the basic concepts in primary healthcare approach. Understanding why PAC is considered a philosophy. Explaining the key phrases in definition of PAC. Describing the core issues and core values in PAC approach. Describing the primary healthcare conceptual framework. And describe how the conceptual framework determines the shape, the direction of PAC processes, and the outcomes in a PHC approach. What are the current realities? Primary healthcare is synonymous with health for all. Access to primary healthcare is the foundation of good health, and PAC is the major determinant and driver of a nation's health outcome. PAC remains an important force in thinking about healthcare in both developing and developed countries. If we apply democracy lens, PAC can be rationalized as health of the people, for the people, and by the people. The realities is that in many countries, the primary healthcare system is the cornerstone and the hub of health system. Over the years, primary healthcare system in Nigeria has remained grossly ineffective and inefficient. There has been systemic weaknesses due to operational gaps ranging from weak and ineffective policies, infrastructural decay, inadequacy in human resources, essential drugs, and other supplies and logistics. The lack of sufficient progress in the attainment of Millennium Development Goals popularly referred to as MDGs, particularly 4 and 5 in many countries, was attributed to weak PAC system. Today, universal health coverage has evolved as a powerful concept in public health. The existence of a well-functioning health system and the timely access to services is critical for attaining universal health coverage. There can be no universal health coverage without primary health care. Attaining universal health coverage is not just an option, but a necessity. The primary health care strategy. Let us reflect. Recall that the historic international conference on primary health care that took place in Almaty in the defunct USSR in 1978. It was the first attempt to unify thinking about health within a single policy framework. And primary health care was adopted as a philosophy for addressing the challenges in health development globally. Primary health care is a model for building health systems that would address inequity and inequality in health outcomes. The resolutions agreed at the conference constitute the primary health care charter and the overall outcome, the Alma-Ata Declaration. Alma-Ata Declaration reflected and represented a shift in global health policy with commitments to address inequity and inequality in access to health care as well as health status of the people. Since Alma-Ata, many countries have been working towards the goal of health for all. However, despite the prospect of primary health care, many developing countries continue to suffer the greatest burden of diseases, and many health systems remain too fragile to cope with the health needs of the majority of the people. There is continuing relevance and renewal efforts towards primary health care. There are persistent challenges in PAC development. However, the global community still believes that primary health care approach is more relevant today than ever before. The primary health care rebirth has therefore become inevitable. There is a global momentum to renew primary health care with costs echoing at national, regional, and international conferences. At the global stage, the World Health Organization set the tone for PAC renewal with the World Health Report in 2008. It was credited primary health care now more than ever before. In Africa, in 2008, there was the Ouagadougou Declaration on Primary Health Care and Health System in Africa, and it was tagged Achieving Better Health in Africa in the New Millennium. Incidentally, I was a participant in this particular conference. The objective of the declaration was to review past experiences and redefine strategic directions based on 9 priority areas on which many countries have based their strategic health development plans, including Nigeria. For many people that are familiar with primary health care, the philosophy current is in primary health care. The PAC is a social strategy concerned about addressing ethical and political issues. Ethical issues mainly in the area of inequity and inequality, and political issues in the area of seeing health as a priority, and also in the area of financing, how to finance healthcare, arising from healthcare, both of which are central to the philosophy. It also recognizes that social conditions has the single most important determinants of good health. It represents an idealist health model with the understanding of health as a well-being rather than absence of diseases. The key phrases in the definition of primary health care. It is very important for us to look at this area. What does the definition of primary health care carry? Essential health care, it is. Primary health care is vital and indispensable to addressing common causes of morbidity and mortality. Primary care is based on practical, scientifically sound, and socially acceptable methods and technologies, meaning it is based on rational and logical techniques and procedures, and not based on voodoos, witchcraft, or mysteries. There are what we call the core values or the principles, and it says that PAC universally made accessible to individuals and families in the community. That is, PAC brings healthcare as close as possible to where people live and people work. It is based on community involvement and participation. The people are central focus and are actively involved in the planning, in the implementation and management, including the monitoring and the evaluation. The people should own and drive primary healthcare. Among the core values is the spirit of self-reliance and self-determination. This element is the key to sustainability. Primary healthcare is based on a cost that the community and the country can afford to maintain at every stage of their development. It is indeed the entry point into the health system. Primary healthcare is the first level of contact of individuals, the family, and the community with the national health system. The core values continues. There is continued healthcare process. PAC is not a system of healthcare. I think for emphasis, I must repeat that primary healthcare is not a system of healthcare, but part of nation's health system. It constitutes the first element of a continuing healthcare process. The PAC approach is a means of achieving health for all. That is, it is a means to equitable access. There are challenges to PAC development globally. Several years after launching primary healthcare, health outcomes are still unacceptably low across much of the developing world. The persistence of deep inequalities and inequity in health status is still a problem for which no country in the world is exempt. Much of the burden of diseases can be prevented or treated with non-high impact and affordable interventions and technologies, yet they are not accessible. What are the core issues in PAC approach? Though often honored more in breach than in observance, there are fundamentally highly valued and highly referenced core issues that are central to primary healthcare philosophy. The issues have become widely shared social expectations for healthcare development in general in all countries. The first is that PAC should be seen as a national policy trust. Nations are required to make strong and continuing commitment to primary healthcare at all levels in the spirit of social equity aimed at improving population health. Nations are also required to adopt PAC as the foundation of the national health system, and health systems should be organized to support primary healthcare and make it effective. Nations are required to establish national strategies for primary healthcare and to translate policies into actions. Nations are also required to articulate national strategies with well-defined goals and implementation plans of action to ensure that primary healthcare is made accessible to the entire population, particularly the underserved and underprivileged ones. Nations are required to routinely review policies, strategies, and plans and ensure adaptation to evolving stages of development. Continue as a national policy. Nations are required to reorientate their existing health system to ensure that all levels of the health system support primary health care by facilitating referral of patients to higher levels of care. Nations are required to provide supportive supervision and guidance, logistics support and supplies, and improve use of referral facilities. PAC elements address the main health problems in the community, providing promotive, preventive, curative, rehabilitative services, and the emergency care appropriate to meet the main health problems in the community. Primary health care is an integral part of a comprehensive national health system and includes all activities that contribute to health at the interface between the community and the health system. PAC must be comprehensive. In order for primary health care to be comprehensive, all development-oriented activities should be interrelated and balanced so as to focus on the problems of the population. It must be comprehensive, and it also means that culturally acceptable, technically appropriate, and appropriately selected interventions should be implemented in combinations that meet the local needs. It must be comprehensive, and this also implies that single purpose or vertical, or what we call the fragmented and selective programs, should be integrated into primary healthcare activities. And there must be functional linkage, which should be sustained by integrated, functional, and mutually supportive referral systems. What are the contents of primary healthcare? Like we said earlier, the components of primary healthcare should include all activities and programs that should address the common problems of the community. And it includes health education concerning prevailing health problems and the methods of identifying, preventing, and controlling them. It should also include promotion of food supply and proper nutrition, adequate supply of safe water and basic sanitation, maternal and child health, including family planning. The components also include immunization against the major infectious diseases, prevention and control of locally endemic diseases, appropriate treatment of common diseases and injuries, provision of essential drugs, and others outside the traditional 8 components are promotion of mental health, promotion of oral health, promotion of primary health care, and the care of the elderly. And what are the principles of primary health care? The key principles of primary health care, the first is, and the most important, is universality and equity. And that is why the slogan is health for all. Universal access and equity is at the center of primary health care approach. PSC approach reduces the gap between the haves and the have-nots in relation to access to health care and result in equity. PSC policies are deliberately skewed to protect the poor and the underserved through greater resources allocation and mechanisms such as insurance, exemptions, and deferment. And then there is the principle of community participation. Primary healthcare is predicated on full and organized community participation and ultimate self-reliance, with individuals, families, and communities assuming more responsibility for their own health. Community participation in the recognition and solution of their health problems can be facilitated by support from stakeholders, both governmental, non-governmental organizations, as well as by accountability to the people. The community participation can also be facilitated through the effective propagation of relevant information and the development of necessary institutional arrangements, such as the committee system of health development committees, through which communities can be mobilized to assume responsibility for their health and well-being. It is recognized that people have the right and duty to participate in the process for the improvement and maintenance of their health. There is also the issue of appropriate technology. Primary healthcare requires the identification and use of technologies and methods that contribute to health, that are scientifically sound, adapted to local needs, and acceptable to the community, that can be maintained by the people themselves in keeping with this principle of self-reliance with resources the community and the country can afford. Appropriate health technology that people can use and afford includes adequate supply of low-cost, good-quality essential drugs, vaccines, biologicals, and other supplies and equipment, functionally and efficient supportive healthcare facilities, health centers, and hospitals. There is also the principle of multi-sectorial collaboration. Primary healthcare is an integral part of socio-economic development process, and close interrelationship and interdependence of health and social development must always be considered. The activities of the health sector must be coordinated at the federal, state, and local community levels with those of other socio-economic factors: education, agriculture, water resources, housing, public works, communication, and industry. There is also the principle of partnership collaboration. Healthcare recognizes the role of partnerships with local, national, and international organizations, both multilateral and bilateral agencies, non-governmental organizations, and key partners in health development. It is recommended that partners give technical and financial support with full respect for the principles of national self-reliance and self-determination and maximum utilization of locally available resources. Partnership entails that partners should support national strategies and plans for primary healthcare as an integral part of overall development. They should also play a key role in the formulation of plans of action at the regional and global levels to facilitate the mutual support of countries and also mobilize other international resources for accelerated development and sustenance of primary healthcare. The PAC development framework, what we call the conceptual framework for primary healthcare development. All countries have political administrative structures consisting of 3 hierarchical levels: the national, the state, and the local. A PAC development framework fits well into this hierarchical arrangement. The configuration facilitates linkage between primary healthcare and other aspects of social economic development. And the 4 layer includes 1, community-based level. This is the level of implementation and the execution of PAC activities based on the goal of health for all, organized for individuals, families, and communities, and managed by the wards, LGAs, and is within the wards and the local government areas. Operational level and support. This is the 2nd level. The structures and institutions at the ward and LGA level constitute the operational level, and they provide overlapping operational support. It is at this operational level that all resources are pooled for implementation of primary healthcare. Unfortunately, this is where the resources are most limited, and that is why we are not getting the desired result in terms of health impact and also health outcomes. There is the technical level, and this level is basically the intermediate level. In Nigeria, it is the state level. The structures and institutions at the state level provide overlapping technical support to PHC operation. It is at the state level that technical options, that's why it's called technical level, are selected or adapted and applied to primary healthcare. We also have the strategic level support. This is the national level, and the structure and institution at the national level provide overlapping strategic support for PAC operations. In Nigeria, the structures at this strategic level include the ministries, departments, and agencies in the health sector. It is at the national levels that strategic choices are made for national policies, priorities, strategic plans, organizational and management improvement, health management information systems, etc. Why the need for the framework? The framework is designed to help ensure that at all levels, other health-related sectors, private sector, development partners, and academia would assist in strengthening health services. It is also necessary because it will help in resolving basic issues, reviewing health policies, and restructuring services with a view to making them people-centered. And the framework also ensures adoption of uniform, appropriate operational units and organizing appropriate support for them at higher level. The framework also ensures adoption of appropriate organization structure for health and social economic interventions, and it also help people, the government, and partners share responsibility for achieving health for all. It helps in overall improvement in health and socio-economic development. Scoping the future of primary healthcare. Getting connected to our platform is as simple as ABC. Join ONTRO at www.ihstrategies.org through your devices, which could be computers, tablets, and mobile phones, and enjoy unlimited learning experience. B. on the lookout. Thank you very much.